Things are going to look a little different on your screen today. We've added a new screen with our ASL interpreter. You might not normally see this unless you go back and watch the recording later, but we want to welcome Johnny. Johnny, you want to give a wave to everybody? All right, well, thank you so much for joining us. And today is Thursday, December 17th, and this is our 33rd virtual community huddle. And so it's always an honor to welcome Gary Herbst, our CEO. And Gary, I have told you for the last several months that I look to you and I watch you for signs as to whether or not I should be worried. And I was in a meeting with you this week, and you used the word dire when you were describing the hospital scenario at the foundation board meeting this week. And I panicked a little bit, but then I was taking notes at the command center, and I was listening to you and the other leaders and the chiefs during that meeting, and one issue after the other would pop up, and you handle it, and then you move on to the next issue, and you handle that one, and you move on. And so we have an amazing team here at Cahuilla Delta. And before we get into the questions, I just wanted to ask you how you're doing and what you're personally doing to keep yourself from becoming overwhelmed during this current surge.
Yeah, thanks, Deb. I probably do look a little tired today. I didn't particularly get a great night's sleep last night. I had a hard time falling asleep, and then I woke up way too early and couldn't go back to sleep. And unfortunately, that is the experience of many of us right now that are in healthcare, that it's hard to kind of calm your mind and turn your mind off. But I still remain positive and optimistic. I've been using a new phrase recently that we always hear, that it's darkest just before the dawn. And I thought that was kind of a fitting description of what we might be experiencing right now. It does feel very dark. I did, if you read the Times Delta, I don't know if it was yesterday or the day before, I did a press conference a couple days ago. And I did use the word grim and dire and alarming. In fact, that same day, I was asked by the Tulare County Board of Supervisors to come meet with them, and I spent probably close to 45 minutes just describing the conditions that we're experiencing right now, which without a doubt, we're 10 months into this pandemic, and what we've been experiencing over the last 2-3 weeks is the most intense period of time that we found ourselves in during these last 10 months. So, but you're right. We have an amazing group of people here, and the leaders. We fortunately were able to physically, be together. Although I had a go-to meeting this morning with our exec team that was a complete bust, and we lost all network connection, and we just decided to call into a conference call, so it felt a bit nostalgic actually being on the phone as opposed to Zooming or GoToMeeting. But my wife and I did set up a gym in our garage, Deb. She's a big fan of QVC, and in fact, they know her on a first name basis, unfortunately. But she saw this Total Fitness gym that was being advertised, and so we just had to get one. So it's pretty fun. So
anyway. We expect you to come in buff in the next few months.
No, probably not. I think I've used it once since it was installed a few weeks ago. So anyway, it's good to be back, and thank you all for continuing to stay connected with us and participating in these now bi-weekly calls. Hopefully you continue to find them informative and of value. As we've always said, when we launched our community engagement initiative, it was about having a group of people in our community that felt a real connection to Cahuilla Delta, and we want you to be ambassadors, to be well informed. We want you to be the first people to know about things. So again, I appreciate all your questions, and you throw some doozies at me this week, being no exception. So we'll talk about that in a bit. So, Why don't I start with the numbers, and I apologize if I do appear a bit more somber today, but yeah, it's a bit challenging right now. So, and that's not just the case with Cuyah Delta and Tulare County. That's really statewide, nationwide, even worldwide. So, so as of Tuesday, which is the state's most recent report, they now have conducted, or we have all conducted collectively, just shy of 28 million COVID-19 tests up and down the state. 1.6 million California residents have tested positive, which translates into a cumulative positivity rate of 5.8% over the 10-month duration. You may recall that it doesn't seem too long ago that California had a cumulative rate of about 2.3%. So we definitely have been seeing a rise in that over the last 3 weeks. The 7-day positivity rate for the state is at an all-time high of 11.1%, and the 14-day rate is slightly lower than that at 10.6%. So when your 7-day rate is higher than your 14-day rate, that means that your positivity rate is climbing. So over the more recent 7 days, it is higher than over the 14-week period. Unfortunately, there have been 21,188 deaths over this 10-month period in California. I guess on a positive note, that represents only 1.3% of those 1.6 million Californians that contracted the virus died from the virus. So that number has come down. So the state actually had been running about 1.8% for a long time. So while we are seeing a significant rise in the number of COVID cases, it appears that a lower percentage of them are actually dying. And I think that's a tribute to the healthcare industry and our doctors and our nurses finding better ways to take care of hospitalized COVID patients and to increase the rate of survival. That number of deaths translates into 53 per 100,000 people. So I'd mentioned that the flu is around 20, maybe slightly less than 20 deaths related to the flu per 100,000 people. So COVID, definitely much more fatal, unfortunately, than flu-related infections. 71% of those that have been infected in California are less than 50 years old. So the greatest number of people being infected, particularly what we've seen over this last month, are younger people. Pretty evenly split among the two genders, 50.6% female, 49.4% male. In Tulare County, it's actually the opposite, about 54% male and 46% female. There are currently 14,283 Californians that are hospitalized, but only 3,081, or 21.6%, are in the ICU. So again, that number has come down. Fewer patients that end up being hospitalized actually end up in intensive care. And as I get to the Cuyah Delta numbers, that's even more pronounced. And then lastly, just over 60,000 California healthcare workers have contracted the virus over the course of the 10 months, with only 230 deaths. So that's where we are at the state level. Dropping down to Tulare County. Well, and just to, again, give perspectives, when I talk about the state, we're talking about a population of 39.8 million people. I dropped down to Tulare County with a population of 484,000 people. So this is as of yesterday at 1:15 p.m. This is what the county was reporting. 262,000 total tests performed over the 10-month period, with 27,390 testing positive. So that's a cumulative positivity rate of 10.5%. compared to the state's cumulative positivity rate of 5.8%. So almost twice as high in Tulare County. We don't report a 14-day positivity rate, but our 7-day, which we do just like the state, is at 14.4%. So the state is running 11.1% for their 7-day, and we're just a few percentage points above that. So that's also probably a good sign, is that I would say Tulare County in this last month is not experiencing the same intensity of infection and hospitalization as other parts of the state, because generally there's been a lot bigger gap between the state's positivity rate and our county. So just a few points now. And then the health equity positivity rate, again, that's in those that quartile of Tulare County that has some of the most vulnerable of our population. Their positivity rate is running at 15.8%. So again, just kind of affirming that there is greater risk of contracting the virus in some of those more impoverished areas of our community. Also, the county reports the adjusted daily new case rate, meaning how many new daily cases of COVID are we seeing over the last 7 days, and they report it per 100,000 population. And you may recall that under the governor's blueprint for a safer economy, there's the 4-tiered system, and that's one of the measurements or metrics that's used to determine what tier you should be in. So for us to move into Tier 2 red, which is the less restrictive, we'd have to have fewer than 7 new daily cases per 100,000, or a total of only 32 per day on average over that 7 days, based on a population of 484,000. Well, we're nowhere close to that. Our daily per 100,000 is at 51.9 new daily cases, which translates into 251 in total every day. So 51.9 per 100,000 people, but when you have 484,000, that's 251 daily new cases over the last 7 days, when we have to be at 32 or below. So we are deep, deep purple right now, but I guess we're in great company. 55 of California's 58 counties are all purple now. And then lastly, we've had 339 deaths, COVID-related deaths over the 10-month period. That translates into a death rate of 1.2%. So 1.2% of those Tulare County residents that contracted the virus unfortunately succumbed to the virus, which is almost the same as the state's 1.3%, just slightly below it. But for us, in terms of our population, it's 70 deaths per 100,000 people. So that is quite a bit higher than the 53 that we see statewide. And then lastly, I'm asked this frequently, but 77% of those 339 deaths are people that are age 65 or older. So while we're seeing, a disproportionate share of younger people contracting the virus, it's generally the older population that actually is dying from the virus. Did you have a question, Deb?
No.
No, okay.
I
All right, and then lastly, moving right down here at Cuya Delta. So this is as of 9:42 this morning. We had 140 COVID positive patients in the acute medical center. It represents about 43% of all the patients, the adult patients that are currently admitted in the Cuya Delta Medical Center. That's an all-time high for us. Although, well, I say that because just a few days ago, we actually hit the all-time high, which was 150 COVID positive patients. Before that, our highest number of patients was back in late July, a few weeks out from the 4th of July holiday, and we hit 91 on a Saturday. But just a few months later, right around Halloween, we dropped all the way down to 14 again on a Saturday, and we were doing cartwheels, really celebrating that and starting to have a lot of confidence. Maybe we got this thing under wraps, maybe people are listening to us, but we kind of held our breath, sat on the edge of our seat because we knew Thanksgiving was coming. We knew colder weather was arriving, which would drive people indoors and hard to distance during the holidays. And that's essentially what we've seen. Today, we're 3 weeks out from the Thanksgiving holiday. Without a doubt, this exponential surge in number of cases being seen countywide and hospitalization is directly related to Halloween or to Thanksgiving and folks gathering and unfortunately, contracting the virus. And then it's generally 2 to 3 weeks out that we see those that are really having great difficulty breathing. That generally is what brings them to the hospital, as they simply can't breathe anymore. So of the 140 COVID positive patients in-house today, only 14 are in the ICU. And 13 of them are on ventilators. We do have one adult patient that's also in the ED that's been confirmed COVID positive, but he's just waiting for a bed to open up. So the vast majority of our COVID patients we are taking care of either on a medical surgical unit like 2 North or 2 South or 3 North, or in the intermediate critical care unit, the ICCU on 3 West or on 5 Tower. So again, I would attribute a lot to that, to the successful use of medications like remdesivir and dexamethasone, but also to earlier treatment for breathing using BiPAP machines or high flow oxygen, which it seems to be effective in bringing up the oxygen saturation of patients. So keeping them off of a ventilator and being able to keep them out of the ICU, that's very encouraging to be able to see that. And also, again, just over the last few days, to watch the number go from 150 to 143 to 141 yesterday, and then to 140. To me, it feels like things are kind of stabilizing, and hopefully they'll stay this level at least until Christmas. But we're pretty certain that, again, 2-3 weeks out from Christmas we're going to see another huge spikelet like what we've been experiencing. The hospital is also incredibly full right now. We're at 94% occupancy. We actually do have a little bit of breathing room in the ICU. You probably are all aware that one of the governor's most recent actions was to create 5 geographic regions throughout the state of California. The San Joaquin Valley region being one that stretches from Stockton to Bakersfield. There's 12 counties that make up the San Joaquin Valley region, Tulare County being one of them. And if the overall ICU bed capacity across that region, which for our region has about 600 ICU beds, we have a total ourselves of 41 ICU beds. But if the total availability of ICU beds across the entire region falls below 15%, then the region goes into essentially a stay-at-home order, where all indoor and outdoor dining closes, nail salons, hair salons, movie theaters, essentially even those things that are allowed to be open in a Tier 1 purple county, they all close down when your region falls below that ICU percentage. So right now our region is reporting 0 availability across those ICU beds, which I think is puzzling to some people, because we've actually started just a few days ago, including on our dashboard, which is on our website and what we put on social media. Today we would report that we have 9 of our 41 ICU beds that are available for occupancy. That's 22% of our ICU beds, which is well above that 15% threshold, so we would not be in that stay at home. But unfortunately, there are enough ICUs that are actually running above their licensed capacity. They're doubling up patients in rooms, that they actually have more than 100% occupancy. So even with us having 22% occupancy, that gets wiped out by those other ICUs that are operating at above their licensed occupancy. So 9 beds available across our 2 ICU units. ICCU, intermediate critical care, a little bit more impacted. Only 2 beds on 3 West and 1 bed on 5 Tower out of our 54 intermediate critical care beds. And then across all of our medical surgical units, 0 beds on 2 South, 1 bed on 3 North, 3 beds in our 12-bed pediatric unit, which just recently was turned into a dedicated COVID adult surge unit now. So we're putting COVID positive adults. Children we're putting on the mother-baby unit. Broderick Pavilion, which is our post-surgical unit, an 11-bed unit, has 4 beds, and then we have 1 bed on 4 North, 1 bed on 4 South. So across all the medical surgical units, we only have 10 of our 249 beds that are open. So that's how you get to that overall 94% occupied, of which 43% of those, all those patients, 322 adult patients in the acute medical center, of which 43% have an admitting diagnosis of COVID. Also, critically important as this pandemic ebbs and flows, something I've reported on in the past, we own 104 adult ventilators in the acute medical center. 73 of them are currently in use right now, 13 of them on COVID patients, the other 60 on non-COVID patients that need ventilation for various reasons. And then lastly, as of today, we now have 781 of our employees and 24 of our providers, physicians, physician assistants, nurse practitioners, that have contracted the virus over the 10-month period. And today we have 230 of our employees that have now tested positive and are on a leave of absence as they work through the recovery of their COVID condition. And we have 5 providers that are currently positive on quarantine. And unfortunately, we have another 80 of our employees that are quarantined at home. They are not COVID positive, but they live with somebody that is COVID positive. So under the CDC guidelines, we have to quarantine them. It was for a 14-day period, but most recently the CDC has dropped that down to 10 and is considering dropping it to 7 or is even as low as 5 days of quarantine. Again, if you test negative but you live with somebody that is positive. So we might be able to bring them back sooner to help their colleagues care for all of our patients, but we would test them upon their return. They'd have to test negative, and definitely would watch them for symptoms and may do a little bit of serial testing after that. So that's kind of the snapshot of the COVID condition right now at the state, county, and local level. So Deb, questions?
All right. Well, yeah. So Gary, our ventilators.
Yes.
Is that the highest number we've had in use in a while, or is that about normal?
This time of year, in the flu season, patients develop pneumonia from flu and other respiratory problems. So yeah, we still have 30-something ventilators that are open. It definitely is higher than what we were experiencing, over the course of the pandemic, because I remember pretty consistently reporting about 50 ventilators being in use. So to have, 73 in use it is higher. Fortunately, we haven't seen much of the flu. We are seeing flu, but I think we've only had to hospitalize 4 patients so far that it was a flu-related admission. And knock on wood, we have not seen any children that have presented with RSV, which is, we often see that not that it skips a year, but this would be a year that we would generally see more of an uptick in it, and we haven't seen it. And I would attribute it to just different behaviors that we're following right now: the masking, the social distancing, not gathering in huge groups and everything. I think is having a positive effect on keeping the flu numbers low.
Okay. All right. Well, thank you for that, Gary. So can you speak to the recent decision to COVID test all admissions?
Yeah, it's something that, like so many aspects of this pandemic, that we're constantly evaluating. And we probably, if we had adequate supplies, way back when, it would have definitely been our desire to test every single patient that came in. But the lack of supplies really kind of inhibited that. Plus, we generally have been doing a nasal pharyngeal swab, which is the deep swab way up into the sinus cavity. That's been the specimen collection technique that we've used on every patient that we have tested in the hospital, whether we're testing them in the emergency department or testing them up on the floor. And that's believed to be an aerosolizing procedure that it can cause a patient to cough or expel molecules or droplets more forcefully when we're doing that nasal pharyngeal. And it's not comfortable by any means too. So we were only really testing symptomatic patients for those reasons. But with the outbreak that we've been seeing, across the county, there have been days that we've seen daily cases in excess of 800. So there's no doubt about it that there's an exponential transmission that is going on right now out there in the community. And we're finding that more and more of the patients that are presenting or people that are coming to get tested at our various sites, they're testing positive, but they're asymptomatic. And that's probably the most troubling aspect of this whole virus. Unlike the flu, when somebody has the flu, you pretty much know it. When you have the flu, you pretty much know it. You feel sick and you look sick. But that's not the case with COVID. You definitely, you can feel very, very sick and obviously die from it. But about 50% of the population doesn't feel any symptoms at all, or such mild symptoms that they chalk it up to, allergies or, a mild cold. So I think it's a combination of probably three things. Number one, testing supplies and platforms have become much more plentiful. With the Quidel and Abbott ID Now, we now have enough supplies and analyzers to be able to test anybody that comes into the hospital. Secondly, with this widespread transmission and so many being asymptomatic, we've actually had more and more of our employees that are contracting the virus. We're feeling greater unease about who is coming in and whether they're positive or not. So definitely it's more precautionary in terms of really knowing if somebody's positive or not. But then probably the most significant is we made a decision last week and have now implemented it that we are no longer doing the nasal pharyngeal swabbing anywhere across the organization. There's been enough scientific evidence to show that if you just do a nares or nostril swab, if you do it properly and collect enough fluid, that the results are just as sensitive and just as accurate of testing for the virus. So that makes it's no longer then aerosolizing. So we can test every patient that comes into the ED. We can test every patient that gets admitted in the hospital in their room without creating that, aerosolizing potential COVID contamination. So it's really that's driven this recent change.
Okay, so since we can do those rapid tests, and I know that we've talked about the visitor policy a lot on these calls, and we've just changed the visitor policy to only allow one unique visitor for a couple of hours in the morning and a couple of hours in the early evening. So can we start testing the visitors as they come in to help ensure the safety of our staff?
Yeah, great question, Deb, and that kind of falls into that, again, continuously, constantly evaluating it. Every Monday, Wednesday, Friday, all of our COVID command center section chiefs meet for now 2 hours to address all of the different aspects of this pandemic and our response to it. And that's definitely where our visitation policies and changes emanate from that section chief meeting. So just yesterday we talked about that, with the Quidel Sophia 2 platform, which is again NAERS based. We have probably 30 analyzers now. It's what we're using in all of our clinics. Could we station those at, say, the Asequia wing entrance, which is where all visitors come in? That's where we have our screening tables. Could we swab them and run it on the analyzer and have them wait, because it takes about 7 minutes to get back a positive test and 15 minutes to get back a negative result. So if you knew within 15 minutes, should we test everybody and just have them wait there? Unfortunately, right now we have, because we've limited the hours that somebody can visit, we're seeing our lines are really queuing up now. And so you can see them stretching out of the Asequia wing door and down, almost Asequia Avenue. So we're looking at creating more, screening tables, and our challenge right now is staffing those screening tables. And yesterday we just don't feel that we have enough staff to be able to do that swabbing and testing and right there at the point of entry. But it is something that we'll continue to evaluate. Because I think it definitely, the reason we're restricting our visitor policy is, again, we want to keep visitors safe, but we also want to keep our staff safe and our patients safe, our doctors safe. And with so many asymptomatic positive cases out there, the last thing we do is want to have a visitor, that comes in, goes into the patient room, takes their mask off to speak to their loved one, and inadvertently infects them. So that's why we're restricting. If we could, get a negative test, or if we got a positive test, obviously we wouldn't let them in. But if they had a negative test, that would certainly put people at greater ease. Current situation is not right yet, but that may change in the coming days and weeks.
Okay. So are we offering the combined COVID flu test at any of our sites?
Yes. So Quidel, and I believe Abbott as well, developed what they called an ABC test. So with that single NAERS swab, we can now test for influenza A, B, and COVID, all at the same time. We are doing that only for symptomatic patients, obviously. So patients that are presenting to our ED or our clinics that are exhibiting, flu-like symptoms, we don't know if it's flu or COVID. And so we use the ABC test on those patients. Patients that are asymptomatic, that are coming, pretty much just for a COVID test, we only run the COVID test on them. We don't run the ABC test on them. It's been very interesting, though. We have seen quite a few patients that have tested positive for both the flu and COVID. Which is, kind of what we were expecting. They're both viruses. They don't necessarily compete, and one wins and the other loses. They can infect somebody with both at the same time.
Okay. Wow, that's scary. When you referenced, when you were talking about the numbers and you said you think this might be the calm before the storm, but we have 141 patients.
Right.
I don't know. That's
Hard
a little
hard to think of that as the calm, huh?
before the storm.
Or I
and then
said,
with it,
yeah. I did also
Yeah.
say darkest before the dawn too. So yeah, this has definitely been the dark days, and I described the dawn as really the arrival of the vaccine. Frankly, that is to me, that's that rising sun, that warm sunshine on your face. We couldn't be more excited about the arrival of the vaccine and what that potentially means for our community and again our entire world. But I'm projecting that we're going to see the number of new hospitalizations over the next few weeks kind of start declining. We are discharging COVID patients. We discharged an expectant mom yesterday. She spent a month in the hospital with us, and she was successfully treated for COVID and went home yesterday. And we did a great celebration for her as she left the hospital. So COVID patients, are being successfully treated and discharged, and I think you're going to see that 150, drop to 141 today. I'm predicting that it will continue to drop over the next several weeks, but then where I lose confidence is 2 to 3 weeks after Christmas, and then New Year's just 1 week after that.
Right. Okay, so let's talk about the excitement that was the vaccine delivery yesterday. We've been looking forward to that with great anticipation. So how many vaccines did we receive at our facility?
Yeah, more than expected. So we knew that the state of California was getting 327,000 doses of the Pfizer COVID vaccine, and we knew that Tulare County was going to get somewhere around 3,000. We were going to get 3 boxes of the vaccine, and each box contains 975 doses in it. So the county initially was going to give 1 case to Cuya Delta, 1 case to Sierra View Hospital, and kind of was undecided in terms of how they were going to use the 3rd case. Well, we just learned Tuesday night that the county made a decision to give Cuya Delta a full 2nd case. So we got 2 cases, Sierra View got 1. So we received 1,950 doses. And I actually heard this morning that it appears that a number of the vials are filled higher than what we were expecting, because you're able to extract, I believe, 5 doses from each single vial, to withdraw in a syringe. But it appears that there's more than 5 doses in many of the vials that actually may allow us to vaccinate even more than 1,950 employees and doctors.
So what you would have to do on that, though, since it's a 2-dose, so that would be enough for 975 people to get both doses.
Yes, but we've been instructed that's not what we're supposed to do. So we're expected that we are going to use all 1,950 doses for this first initial dose. So we will work down our list over the next 5 days until we vaccinate 1,950 or slightly more than that. And then in a little less than 3 weeks, we will receive another 1,950 doses to give that 2nd dose.
How confident are you that you'll receive that 2nd shipment?
I'm very confident. Yeah, either the county has already been assured that they will receive 2 cases. They're a bit confused, curious why they've been told they're not going to get 3 cases like they did this first time. But then I think we got confirmation that if the county doesn't receive 3 cases, then we'll get another case directly from the state. But we are confident that we'll get that second case, those two cases of the Pfizer vaccine in less than 3 weeks. But Moderna has also, and this could happen as early as today, that the FDA will approve Moderna's messenger RNA vaccine, which has pretty much the same effectiveness as the Pfizer vaccine. It actually is a little bit easier to handle. It doesn't require, storing it at a negative 70 degrees Celsius. So a little bit easier to transport and to secure. And we've been told that Tulare County will receive approximately 5,000 doses of Moderna shortly after it's approved by the FDA. So we could actually see next week the county receive its 5,000 doses of Moderna, which we expect that Quia Delta will receive an allocation of that vaccine. It also is a 2-dose vaccine, but unlike Pfizer, that's 21 days apart, the Moderna is 28 days apart. And then for both of them, they believe that immunity occurs about 2 weeks after that second dose, both of the Pfizer vaccine and the Moderna vaccine.
Okay, so can you mix them, or do you have to stay with if I get Pfizer the first time, do I have to get Pfizer the second time?
You do. And same if you get Moderna the first time, you need to get Moderna the second time. Again, they're both mRNA vaccines, but they have slightly different properties, and so you wouldn't want to mix them.
Okay, so I know the hospital has made a list, and you have prioritized staff members based upon their patient interactions and their proximity to COVID positive patients. But what about the community? Is there a priority for community-based organizations to receive the vaccine?
There's still a lot of uncertainty around that, Deb. There's no doubt about it that the FDA, the government, has been very clear that they want the initial vaccines to go to frontline healthcare workers and to skilled nursing home residents, skilled nursing unit residents, first responders, EMTs, fire, police, those that are at the greatest risk of an exposure. They want the initial vaccine to go to them. And so the vaccines that are being released that we just got yesterday and that will come from Moderna will all be administered first to our healthcare workers. And then I think Walgreens and CVS have a different arrangement with Pfizer and Moderna and the government, that their vaccines, and this is for the skilled nursing homes and the nursing homes, that their vaccines will come through Walgreens and CVS. I don't know exactly how that's going to work. But then, we're hearing tens of millions of vaccines will then start being distributed across the country in the first part of 2021. And how many of those will come and who they will be directed to, I'm certain that they will first want to target those people, the general population, that are at greatest risk of contracting the virus or having hospitalizations. Those that are older than 65, those that have underlying chronic conditions. That would be the way I would prioritize it, and I suspect that's the way that the county health department will also. And they'll play a big role in that prioritization. I think Quia Delta will play a big role in the actual administration of the vaccines. We vaccinate the general public through our clinics and our ED and our urgent care centers, and so we would expect that those would be vaccination sites for the general public as well.
Okay, so but right now Walgreens and CVS, when they get theirs, it's only going to be for nursing homes.
That's my understanding, that they are not receiving vaccine for the general public, that they are the conduit that is being used for nursing homes and skilled nursing facilities across the country.
Okay. So can you explain the decision for Korea Delta not to require their staff to get the vaccine?
Yeah, I think it's it's recognizing, acknowledging the understandable fear and anxiety that people have. It's not just unique to the general population, but there are doctors and nurses and other Korea Delta employees that have their own apprehensions. Um, I think there are folks that in general are uncomfortable with vaccines. We know that. We did, along with pretty much the rest of the hospital industry a few years ago, we made flu vaccination mandatory at Korea Delta. And that's really to protect our patients. While we certainly want to protect our employees, it really is to protect our patients. But we do allow exceptions to that. And when an employee chooses not to get a flu vaccine, they actually are required to wear a mask from the 1st of October to generally the end of March, or even into April. And we don't have it's a very small single digit percentage, less than 5%, maybe 2 to 3% of our employees don't get the flu vaccine. They choose to wear a mask. But the flu vaccine's been around for a very, very long time. We know a lot about it, a lot of studies, and so I think people are more comfortable with that vaccine because they know what it is. They have more trust in it. While this vaccine, all scientific evidence indicates it is very safe, very effective. It was developed in an unprecedented warp speed, to literally have a vaccine with this kind of efficacy in 9 to 10 months is incredible. It's a testament to our brilliant scientists in this country, in this world, and the incredible logistical, abilities of companies like Pfizer and Moderna. And so bless them for their incredible work. But I think the fact that it was developed so quickly has just created some added anxiety that people just are they're not ready to fully trust it. And so we respect that. And what's interesting is even when you're vaccinated, after you're vaccinated and 2 weeks after that second vaccination, the FDA and the CDC are still strongly suggesting that people continue to wear masks. Which is interesting, and I think people are going to really struggle. If I have immunity now, why am I still wearing a mask? And so we'll have to kind of further evaluate that when we get to it. But
There was a time that I used to feel sorry for the people who refused the flu shots because they had to wear the mask.
right,
And now it's all of our fate. But Gary, you are, and we said this a couple of weeks ago, that we wanted you to take it first so that we could sit back and watch you to make sure,
yeah,
you
yeah.
didn't fall over.
Because you're really concerned for me. Thank you. Yeah.
Well, even the staff for our employee huddle tomorrow, the staff members are like, we need assurance from our leaders that they feel confident and they're comfortable with this vaccine. So you are phase 4, though, because you're not in direct patient care. But you're confident, right? You feel confident in this vaccine.
Absolutely. I fully intend to take it, and I told folks I'd be happy to be the very first one. If that gave that sense of confidence, if our CEO is willing to take it, then so am I. But I'm also willing to go last because I want those that have the greatest risk of exposure. I want to give them all the protection that we possibly can. So I'm not going to selfishly, jump in front of the line and take one away from a nurse or a doctor. But yeah, I fully intend to take it. I really believe in science, and I don't believe that the FDA or Pfizer or Moderna would be cutting corners and putting people at risk. I just don't. I don't believe that there are people that would be that irresponsible, understanding, particularly under the circumstances. You've had, 300,000 Americans have died of this virus, and to contribute, further illness or potential death is, I don't believe it.
Okay, so we'll just say it again. We will have the vaccines out at the clinics and stuff once all of the essential workers are are vaccinated, and then it will eventually trickle out.
Yeah, that and I don't. This is where I don't want to speak with really any certainty yet, Deb, because
Okay.
there is definitely more uncertainty. We only know what we now know. And that's really the 3,000 doses that came to the county. But I don't know how quickly Pfizer and Moderna and the government are going to start releasing other vaccines. So we will work on those logistics. We're already working with the county around plans, like as they come in and in what quantities. How will we distribute them? Pfizer is still, you got to have the deep freezer. We don't have our freezers yet. They're all back ordered. Everybody's scrambling for them. I did read that Fresno State loaned their deep freezer to Community Regional Medical Center. The county ordered one for us, and we ordered one ourselves. They haven't been received yet, but fortunately, the boxes that Pfizer ships their vaccines in is very sophisticated and function essentially as a deep freezer, rechargeable with dry ice, and they can freeze up to 30 days the vaccine. So it's those kind of logistics, that are going to affect. You can, after you take it out of the freezer, it can be stored in the refrigerator for 5 days as you thaw it out for administration. So it's really going to depend on a lot of factors, where it gets deployed throughout the county and how it gets administered. We were talking this morning with Ryan Gates, who oversees all of our clinics. And we have deployed a lot of resources, staff and supplies, and out to the clinics to do COVID-19 testing. We would love to see that effort shift to COVID-19 vaccination. And so we would be ready to pivot, because as we start vaccinating everybody, you think, well, then we need to do less and less COVID testing. So let's use those resources for vaccination. So if depending again what happens, that's what we'd be prepared to do.
Okay, thank you. So it was suggested by one of our community members that we work with the Chamber, the Unified School District, and COS to just get the word out about the importance of vaccinations. And I'm sure that messaging will be coming down the pike somewhere. And then there was also a question about there are articles about the rich and famous being able to receive the vaccine before regular folks such as us. But I think that's always the case.
I had to smile when I read that question, because I haven't read any articles myself about that, but I think we all know and believe that those that are in positions of power, that have wealth, they're able to secure services and products earlier than the average person. So I fully believe that that will happen.
Okay, so I'm going to pick your brain with this final question. So is wastewater testing being done for COVID in areas around Tulare County? Some colleges are doing it,
Yeah.
and it shows it's coming in. Do you know anything about that?
I do now because of the question. Yeah, I didn't before, but yes, it's absolutely true. I printed an article published by the CDC that talks about wastewater, sewage water, essentially, that we as human beings, when we discharge into the sewer system, that we release the ribonucleic acids, the RNA, in our bodies, and that RNA carries, if you're infected with the COVID virus, it's going to be in that RNA that's discharged into the sewer system. And so it is a way that the CDC has talked about being able to do monitoring or surveillance or early detection of where you might have COVID outbreaks in particular communities. So yeah, it has largely been used in universities, colleges, prisons, food processing plants, where you do have a lot of congregate living, dorm style, or definitely in a prison. Or we've read about large outbreaks at foster farms and other Reese Foods, and but oftentimes they have their own sewer systems, and so you can test the wastewater that's in close proximity to those facilities, and get a sense of how prevalent the virus might be from that. And so you might early on know, wow, there's an outbreak in this facility. They haven't been tested yet. Maybe they're not, maybe a lot of them are asymptomatic, but by testing the wastewater, you can detect it. It's pretty complex to do it. I put an email out to Tim Lutz to find out if Tulare County was doing anything like that. I haven't heard back yet from Tim. I'd be very surprised if we are. I highly doubt that we are, just after reading the article and seeing the complexity that goes into it, and the laboratory testing and the separation of the RNA, and not an easy task.
Okay. All right. So we have a couple of chat questions, Gary. Have you seen patients of employees testing positive multiple times throughout this period?
Yeah, it's a great question. I think it's been asked in the past. We have not seen it among our patients or our staff. We have read stories about a patient. The first one I read was a gentleman in Hong Kong that had been confirmed that he'd contracted it twice. Because the thing that's, again, kind of crafty with this virus is dead virus cells can test positive for 3-4 months after you were infected, even though you're no longer contagious. In fact, it's believed that you're only contagious for about maybe 7 days, maybe 10 days from the onset of the virus. But we've tested people months and months after they first tested positive, and particularly when you're doing it using one of the molecular PCR tests like the Abbott ID Now, you'll continue to test positive when we know it's dead virus cells. So you got to be careful to think that, did they get it again? 2 months, 3 months later, we're testing them and they're testing them positive. If they're not showing really any symptoms at all, it's highly unlikely that they have a fresh infection. But the gentleman in Hong Kong, they did test in a way that they believe that they confirmed that the second infection was a new infection, and largely because the DNA of the virus was slightly different. And so they're thinking that there might have been a slight mutation of it that caused him to be reinfected. But we also know that we've tested quite a few employees that tested very strongly that they were infected with COVID, but then several months later got the antibody test, the blood test, and they tested negative for the antibodies. So that's why the government has strongly recommended that even patients that have contracted the virus and fully recovered, they should get vaccinated as well, because the antibodies they might have developed from the natural infection may no longer be with them, or may not be as effective in preventing a future infection. But this RNA-based synthetic vaccine can be much more effective in creating a very powerful antibody presence.
Right. So one of our community members just emailed me, and she said that her son, who is an ED physician, saw a patient who was positive in March and then had symptoms again in July, and this was confirmed in Nevada.
Yeah,
So,
I hadn't heard that, but yeah, and I'm again, that wouldn't surprise me. Again, just what I just described, that we don't know from the natural infection If you do develop antibodies and that creates immunity, and if you do, how long does it last? I mean, in at least a dozen employees, 4 months after their infection, they didn't have any measurable antibodies. So to me, that means they didn't have any immunity either. But this, this vaccine developed by both Pfizer and Moderna, I think they each tested 30,000, study participants. Half got the vaccine, half got a placebo. They studied it over a long period of time, and those that got the vaccine, very few of them actually contracted the virus, 5% or less. And those that did contract it, for the most part, their symptoms were more mild when they did. I do believe a couple people died of COVID that were part of, I think they were in the placebo group though. Nobody died that was in the actual vaccine group.
Okay. All right, so a final chat before we go. Are we seeing that most of our frontline workers are willing to take the vaccine?
It's a great question. I was on a call this morning. So we're going to do the testing. We're going to start at 6:30 a.m. tomorrow, and we're going to run till 3 o'clock p.m. We're going to do that over each of the next 5 days, so Friday, Saturday, Sunday, Monday, Tuesday. We hope to do 400 vaccinations a day over that 5 days. That'd be 2,000, which would use up those 1,950. We have a registration system that patient or employees and doctors can go on to and register for their vaccine on any of the 5 days, and there are 1 minute time slots to give the vaccine. As of this morning, we only had a little over 200 of our employees and doctors that actually had signed up of the 1,950. So, and only 80 something had signed up for tomorrow. But I only heard like 11 employees have actually declined at this point. So we need to get the message out. We're encouraging all of our leaders to get their employees signed up, and everybody that wants to take it, we want to hurry up and get them signed up because we actually we have a list. We have 5,747 employees and doctors. The very first group has 1,668 people in it. Those are the highest risk. The bedside, clinicians, the housekeepers that go into COVID positive rooms, and respiratory therapists and so forth, and the doctors working on the front line. So we can actually vaccinate all 1,668 of those people, and then move into phase 1B, which has another 1,403. So we could start making our way down that list as well. So we want to hurry up and fill up all those slots to see exactly where we're going to fall in that priority list.
Right. Okay. Well, thank you so much, Gary. And thanks all of you for joining us today. This will be our last update of 2020. We will be coming back the week after New Year's for an update for you. So, Gary, let's wish everybody a happy holiday, and why don't you close it out?
Yeah, thank you. Gosh, I didn't realize this will be our last one of 2020, and I'm so grateful for that. I want 2020 to go away as badly as everybody else, and welcome in a much healthier and prosperous 2021. So on behalf of Deb and Maria and Daniel here in the studio and our entire Cahuilla Delta family, I do want to wish all of you a very happy, safe, healthy holiday. I know it's going to be different. I know it's going to be tough, but it's certainly still a time that we can take a moment to just reflect on all the incredible blessings in our life, our family, our friends, and just my strongest well wishes to all of you. So I look forward to seeing you again in the first part of 2021.
Okay, wonderful. Thank you all.